Hi, I'm Dr. NGYN and I have a clinic in Portland, Oregon. I'm going to answer one of our frequently asked questions about laser vaginal rejuvenation. Women during a consultation often ask about nerve damage. They want to know if an aesthetics procedure is going to affect their sensation sexually, if they're going to have numbing, which is loss of sensation, or if they're going to have heightened sensitivity, which can be irritating. Both of these things are found under the questions area of these procedures. When you look at this diagram, it's important to note that when we're doing a labiaplasty, someone who's been properly trained knows that the primary sensation to a woman is in the clitoral area. I'm pointing to the clitoris and the frenulum, and this is where primary external sexual sensation is felt by women. And on this diagram, I'm pointing to the G-spot, the Graffinger spot, which is on the inside. So these are primarily the two most sensitive areas on the female for female sexuality. When doing the procedure, it's important that a surgeon is aware of the nerve supply and the blood supply of the female genital structures. When doing a labiaplasty, if we're careful about staying in the area where the problem is, where the excess tissue is, and stay away from the clitoris and the frenulum, there is no possibility of nerve damage in this area because the nerve supply comes from the midline and we stay away from the midline. We have not had patients describe either feeling numbness in this area or a heightened sense of sensitivity from the procedure. Externally, as a surgeon, I'm very careful to identify the anatomy and do the labiaplasty starting in the appropriate area to keep the frenulum smooth and anatomically the same as it was before. And inside, when one has a vaginal rejuvenation with the procedure, we're very careful to stay away from the nerve supply. So really it is just a trimming of the skin and a tightening of the muscles, but no nerve damage is carried out. My experience is that women have improved sexual function after laser vaginal rejuvenation because they feel better about how things look and they feel better about how things feel.